Hey guys, Ashley with Amare. So few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye. Hey guys, it's Ashley with Amare. Hi. Okay, so today we're talking about Renuvion. Renuvion is also known as jplasma. Renuvion is a body tightening, skin tightening procedure thingy that can be done with or without liposuction. So when you guys hear Renuvion, I know everybody thinks about like the FDA and like Renuvion's bad and complications and all these things, right? Let me just preface this whole video. Nothing in the plastic surgery world is good or bad. It's how it's used, who's doing it, and how you're taking care of it. Renuvion is not bad. It is just a thing. So Renuvion used to be called jplasma, and then they changed the name, and now it's Renuvion. There's also Body Tight, which is a skin tightening, another skin tightening thing. But these things are used to tighten the skin where you're in that in-between space that you don't have enough skin to do a tummy tuck, but it's loose skin and we want to snap it back. We want to tighten it. We want to get that collagen back, right? Renuvion is a device. It looks like a wand with a little electric probe on the end. And I am going to share a reel this week instead of my normal. Actually, maybe I'll do it as a post. I'll show you guys the actual device itself and what it does and what it looks like. But it's a wand with like an electric probe on the end, and it kind of looks like it shoots lightning when you see it. So it's not like a regular cannula that goes in, right? Like the thing that does the liposuction. It's a separate device that they add to the liposuction, or it can be done without liposuction. So this thing is attached to a box, and the box has a bunch of dials on it and settings. Where it goes wrong with Renuvion is if you are going to a med spa by a surgeon, or not even a surgeon, like a technician that's not really a surgeon using these devices. That's where it goes wrong. So if you are going to get Renuvion, please make sure you are going to a plastic surgeon who is experienced in Renuvion, who is trained in Renuvion, who is also doing your liposuction, or if you're not doing liposuction, is an actual board certified plastic surgeon. I have a post on my Instagram somewhere that explains what to look for when you're looking for a board certified plastic surgeon. So there's that. I also have a video about it on YouTube. But let's get into Renuvion. So what is Renuvion? I have a couple different articles because there is no like one straightforward article, which is why I'm doing this video, because it's kind of confusing to try and figure out what this is, right? So this one is from Howland Plastic Surgery, and it says, what is Renuvion? Renuvion, also known as jplasma, uses radiofrequency waves to deliver helium plasma underneath the skin to tighten and improve the appearance of loose skin. Renuvion is a minimally invasive procedure that is sometimes performed in conjunction with liposuction. It can also be performed on its own as an alternative to surgical lift procedures. So again, like I said, if we don't have enough skin for a tummy tuck, but we want to tighten that skin a little bit, that's where it would be used. Or like a little bit of tightening. A lot of times it's used on the chin and the neck. I see a lot of Renuvion there. I see a lot of Renuvion in the arms because there's not enough skin to do an arm lift. We just want to tighten up to make that area that we took the fat out of not loose skin. Because think about it like a balloon with air in it, right? And if we have that thing blown up for so long and then we take out like half the air, the skin on the balloon is going to get saggy because that elastin and collagen isn't there. So that's what we'd use this for. So let's talk about it. Radio frequency waves to deliver helium plasma underneath the skin. There's a different article. I'm going to read this first. There's another article that goes way more in depth about it, and we're going to get into that. But it's basically, so Renuvion is like hot, cold, right? So the radio frequency spits heat, and you can actually see it in some of the videos I'm going to post, where you can see the little lightning bolts under the skin where the actual like energy goes. But that part heats, and then the helium gas cools, and it causes a contracting effect. So it's actual helium plasma gas with radio frequency lightning bolts. That's what's going on under the skin. How does Renuvion work? Renuvion works by making several small incisions to a treatment area. If you're getting lipo, you already have these incision areas, so they just go in. A specialized handpiece, that wand, is inserted under the skin, where it releases the radio frequency energy, lightning bolts, underneath the skin, which is converted to helium plasma. Once the steady stream is achieved, it produces heat that contracts the skin and tightens it. The heat promotes the production of collagen, which continues to help tighten the skin over the next few months. Unlike other plastic surgery procedures that require lengthy time, Renuvion is done in an hour or less. Renuvion is a lot of times, like we said, an add-on to the lipo. So it's just kind of done in conjunction. Alrighty, so Dermaplastics Arizona has an article, which I actually really like. This was the most comprehensive article that I found. What is Renuvion? Renuvion is a minimally invasive skin tightening treatment that combines the unique properties of helium plasma with radio frequency energy to create a dual thermal effect. So like I was saying, that hot-cold effect. The helium's cold, the radio frequency is hot, and it causes a contraction. The helium is actual gas, by the way. It is the latest technology that has been FDA approved for skin tightening. It works by passing helium plasma energy under the skin. This helium gas is energized, so the gas is in there, and then it's energized by the radio frequency waves, and it does like a chemical reaction thing. This plasma beam of plasma. The plasma beam heats and contracts the skin and the fibroseptal network. So basically, we're going to take a pause there real quick before I read this next part. When those little lightning bolts are coming out, it's not just randomly shooting straight into your body. It's actually trained to seek out collagen tissue, which is pretty cool. Honestly, it really is. There is a video on YouTube. I don't remember what it is, but I will post it when I go back and I look at it, where they talk about the actual scientific setup of how the little lightning bolt searches for just the collagen tissue itself, those collagen fibers themselves. It seeks them out, and then it like zaps them, and they start to like shrink, and the helium gas is in there. So once it zaps them, everything starts to contract. But it's meant to target and designed to target specifically those collagen like fibers under your skin, if you want to think about it that way. Okay. Excess helium gas cools the area. This process tightens and shrinks the underlying tissue. Wrinkles and texture are improved, skin tightening and firming. In addition to these instant changes, Renuvion stimulates the production of collagen for long-lasting improvements. Okay, how long will my results last? This is a big one. Immediately upon completion of the treatment, most will see that the skin is tighter and firmer. I am going to post a picture from one of the conferences, or actually a short video, where they show using a chicken thigh, like a chicken cutlet almost, and they put the Renuvion wand under there, and you can see the little lightning beams searching and like zapping the little collagen fibers, and you can actually watch the skin of the chicken shrink, and when they peel it back, the muscle and tissue underneath are completely untouched. It's actually really, really cool. So during the next 6 to 9 months, your skin will continue to improve due to the increased collagen production that remains from the Renuvion treatment. So we have a window. Renuvion happens the minute it starts, the minute the treatment's applied, right? The wand is in there. But we have a window, which is I'm gonna talk about the complications, and I'm gonna talk about the fibrosis and the hardening and the irregularities of the skin. I'm gonna talk about all of that, and this is gonna make sense. We have a 6 to 9 month window to fix and get rid of any fibrosis you have building up under the skin due to Renuvion. And it's not due to the Renuvion itself or the treatment itself, it's due to the fact that there is zero aftercare. They treat this like it's a one and done thing. It is still a cut. It is causing immediate tissue remodeling, 4 phases of wound healing, right? Homeostasis, inflammation, proliferation, and remodeling. So it starts that immediate like proliferation and remodeling phase where your body is trying to tighten up and make that collagen fiber situation. But if you are pairing that with something like liposuction where you have swelling in between there and it starts trying to make that, it's going to turn into immediate fibrosis if you are not getting rid of the swelling. We're going to get into that a little bit later. Typically patients only need 1 to 2 treatments, blah, 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 blah. In fact, it is estimated that the treatment for the face and neck will last a minimum of 5 years, especially with good skincare. Okay, so another one. This is from healthcareutah.edu. How does Renuvion tightening work? Okay, I do want to show you guys this picture, but I'm going to read this first. For the Renuvion procedure, the specialist creates a small entry point, placing the device just under the skin. Once the device is in place, the specialist releases pro-helium gas and radio frequency to create a precise stream of energy or plasma. So plasma is just energy. That's all it is. The plasma part, jplasma, is just the energy part, where it's actually the helium gas that's being released into your tissue along with the little lightning bolt, and it's causing a shrink wrap effect. So this energy generates enough heat to contract the skin while at the same time excess helium gas cools the treatment area. This combination of energy contracts the tissue just under the skin, which tightens it. Cool. Okay. So what are the problems with this then? Why was the FDA all up in arms? Or like why was everybody like, oh my God, Renuvion's the worst thing ever? All right. So this is from the American Board of Cosmetic Surgery.org. Okay, and this is the article on Renuvion. I don't want to read you guys the whole thing. It's a lot, but this is from April 2022. This is when the FDA first released the warning about Renuvion. Okay, so the FDA safety communication reiterates, sorry guys, the FDA safety communication reiterates that Renuvion is FDA cleared for general use of cutting, coagulation, and ablation of soft tissue during surgery. However, it cautions that the use of this device has not been determined safe or effective for any specific procedure intended to improve skin appearance. So Renuvion was originally approved by the FDA for cutting, coagulation, which means like when you have a scab and the blood turns into a scab, that blood is coagulating, it's thickening. And ablation of like blasting of soft tissue. It was never really intended to improve skin appearance. Off-label use of Renuvion. This is important. Renuvion has, in practice, been commonly used to tighten skin in the face and body since 2019. But as the new FDA statement emphasizes, these aesthetic applications of the device are considered to be off-label or not specifically FDA cleared. So what it means is off-label is like it's cleared by the FDA that it's safe, but the FDA hasn't specifically said for this specific thing that you're using it for, right? So let's just say like face soap is FDA cleared for the face, but it may not be for your like sensitive private parts or whatever, right? So it's cleared for one thing specifically. Is it used for other things? Yes. But has the FDA evaluated that to the full extent and been like, hey, this is like good to go for that as well? No. So off-label use may sound concerning, but it's a standard practice for drugs or devices to be applied in ways that are not yet specifically FDA cleared or approved. Like I just said, they didn't specifically say that's what it was for. Botox Cosmetics, for example, is used in the lip area to smooth lines above the upper lip or create a lip flip effect, where they're like, hey, like this effect. But this is an off-label use of the neurotoxin, which is FDA approved for treating forehead lines, glabellar lines, and crow's feet. Similarly, many medical devices are used off-label way before additional use-specific FDA clearance or approvals are granted. The American Board of Cosmetic Surgeons, board-certified cosmetic surgeons, have found that the Renuvion device offers unique benefits to patients and believe it to be very safe and highly effective for skin tightening when performed by a board-certified cosmetic surgeon specifically trained in its use. What did I say in the beginning of this video? All of the horror stories and all of the things that I've had to fix with fibrosis from Renuvion or burns from Renuvion and like trying to make sure the skin doesn't scar is because they're getting it done at med spas by people who are not even like medically licensed to be touching this stuff. That's where I'm seeing a lot of the issue, because I've seen beautiful results with Renuvion from plastic surgeons that are certified to use this. So seeking further FDA clearance for cosmetic use. Renuvion manufacturer Apex Medical has submitted applications to the FDA seeking to receive clearance for the Renuvion device to be used for skin resurfacing and to treat wrinkles. Additionally, on April 4th, the manufacturer announced that it submitted clinical study data to the FDA in hopes of receiving FDA clearance for treating lax skin or tightening skin in the neck and below the chin. ABCS, American Board of Cosmetic Surgeons, will continue to monitor this clearance. Blah, 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 blah. Okay, so here's the juicy stuff. Potential side effects from Renuvion. The following adverse events have been reported to the FDA after Renuvion was used for cosmetic purposes: burns, infections, changes in skin color, scars, nerve damage, significant bleeding, and air or gas accumulation under the skin, in body cavities, or in blood vessels. According to Apex Medical, which is the company that makes Renuvion, these negative side effects were reported in 0.04% of Renuvion cases performed worldwide in both 2020 and 2021. Yet, this may not be the cause for undue concern. The 0.04% complication rate of Renuvion is low compared to that of other cosmetic common surgical procedures. For example, when performed alone, liposuction may carry a complication rate of 0.7, rhinoplasty a rate of 0.58, and facelifts a rate of 1.8. How many patients have experienced negative side effects with Renuvion? 15 patients saw negative side effects in 2020, compared with the 32 patients in 2021. But the number of patients receiving Renuvion also more than doubled between 2020 and 2021. So even though the number of affected individuals was larger in 2021, complication rates remain steady and acceptably low for surgical procedures. Here's the thing, guys. Look at these numbers. 2021, COVID, and then after that, everybody and their mother is doing things now that they have no business doing because they want to jump on the trend, because TikTok told them, because opening a med spa is a trend. Like, guys, who is doing the thing? That's what I want to know. Who is doing the thing? Are they allowed to be doing the thing? Are they trained in doing the thing? No? Then don't let them touch you and do the thing. It's beyond me. But a lot of what I hear from these devices being reported is that. The other end of it, the rest of this article just says how to choose a surgeon and all of that. Now we're going to go into the Ashley with Amare rant. Okay, the other end of that is the post-op care. Let me explain to you what's happening to your body. All right, so we get liposuction, okay? We go in there, we suck out all the fat. Now we got loose skin. That's one layer of trauma. That's one gigantic brown grizzly bear raking up your skin. Okay, then we're gonna go another layer above that, and we're gonna use heat, cool, plasma energy, and basically zap and start to shrink the collagen under your skin. That's a whole nother layer of damage. That's not even like a regular cut. That's an accelerated process. So you have to be very, very careful if you're getting Renuvion. This isn't, oh yeah, it's okay. No, if you are getting Renuvion, if you have had Renuvion and you're having skin irregularities and you're having bumpies and lumpies and your skin feels tethered down and it's not soft and it's not supple and it's starting to congeal really, really tight and hard, you need to find a manual lymphatic drainage therapist. You need to set up a consult with me. You need the Amare Lipo foams and the post-op cream in your garment immediately, because what is happening? You're swelling from the liposuction surgery, that first level. Picture that like a giant pool, okay? And then we have a pool cover on top, And not only are we stretching it, but then we're shrinking it down and compacting it on that body of water. That body of water is going to have trouble moving. And that body of water is supposed to be moving back into your body. You absorb it, and then you pee it out. That's what's supposed to be happening. Your skin, even with Renuvion through the healing process, should never be hard. If it starts to harden, number one, you're having too much salt in your diet. You guys have no clue what I mean when I say that. Please set up a virtual. 2, you're not drinking enough water. 3, your garment is 10 times too tight or 10 times too loose. And 4, you do not have foams or manual lymphatic drainage massage. Either or all of those things are happening. Every single time someone comes in with fibrosis from Renuvion, it is one or all 4 of those. That's because of the healing process. It's because you then went and got massages where your skin is already so traumatized. You went and got massages that are raking over that skin, that are pressing deep into that already broken tissue. When you guys get Renuvion, your body and your collagen are starting to make collagen fibers really, really thick all at once and trying to like pull them back and shrink and tighten up, right? It's all coagulating and congealing. We know that fibrosis is swelling that is starting to get thick and congealed and coagulate. So fibrosis is those hard lumpy bumpies. That's supposed to stay swollen. That's supposed to stay as swelling. As you get your manual lymphatic drainage massages, all of that starts to reabsorb and come down, but it's supposed to stay watery. When you are getting massages that are congealing the fluid because it's pushing it and squishing it and rubbing it and digging into it and not actually getting it to reabsorb into the lymphatic vessels, all you're doing is speeding up that coagulation process that's already in hyperspeed from the Renuvion. Do not, I cannot say this enough. If you are getting Renuvion or had Renuvion, please, for the love of all that is plastic surgery holy, do not go to anyone that is going to rub you, rake through you, use tools, use cups, use more radio frequency. Guys, the radio frequency is already in the device. It is already tightening your skin and thickening all of that tissue and trying to get it to shrink and heal. And you are going to go do radio frequency cavitation and zap it even more and congeal it and thicken it even more. That is not going to help. We already did that. Doing more of it's going to make it worse. Do not do that. This is also not something that you can break up because it is not scar tissue. It is swelling that is getting dehydrated and thick and stagnant and stuck underneath your skin. The reason it looks freaking crazy is because that pool cover is being shrunk wrap onto the body of water. So anything in that pool, like any pool toys or any bricks or any rocks or any like lumpy bumpy things, right, is going to show really, really apparent through the skin. It's the same fibrosis you would get with liposuction. It just looks so much worse because that skin is shrink wrapping around the fibrosis and swelling. So the irregularities are more prominent. On top of that, as that skin is shrink wrapping, because it is immediate and then it does continue thereafter, but as that skin is shrink wrapping, it's trying to heal. So it has its own layer of swelling that is starting to thicken and congeal. So it's like 2 layers of fibrosis pretty much. It's got its own swelling. It's got its own healing path. It's a second layer of trauma. So we need to make sure that if we've had Renuvion and we're having this tightness, this hardness, this congealing, this thickening, that you are finding a manual lymphatic drainage therapist immediately. Someone that's going to do this gentle skin pumping technique. I'm literally pumping the skin. That's all I'm doing. It's as gentle as this. I am not pressing deep at all. I am laying my fingers on my skin and just moving it. It is this gentle, rhythmic, in a certain way, following the lymphatic mapping. Very, very gentle manual lymphatic drainage technique. That is it. That is all you should be getting. Excuse me. When you guys call places and look for manual lymphatic drainage, you will find someone who says they do it. You get in the room and they're rubbing the living daylights out of your Renuvion area, or they're doing long, deep strokes, or they're using oil, or they're using machines and tools and rollers. Please, no. If you need to find a manual lymphatic drainage therapist in your area, Our post-op course, post-op lymphatic massage and finding a therapist, is designed to teach you how to do that. The only way you're going to know how to do that or what to look for is if you learn about the lymphatic system. If you learn about the 4 phases of wound healing, how your swelling works in your body, how the map is supposed to go, how your body gets rid of swelling, how fibrosis is made out of swelling, why fibrosis is made out of swelling, everything that you're going through, all of that is in there. And once you learn all of that, and once you learn the lymphatic map and why the technique is supposed to be the way that it is, and how it is a skin moving motion, you'll understand why it works for Renuvion. Because again, we are working directly with the skin. The surgery was done directly under the skin. We are getting anything that is trying to tether and thicken and stick and doing any of that directly under the skin. We're getting that to reabsorb immediately. It works immediately. Your body starts processing and reabsorbing all of that out. So the course is on our online shop, amarepostopshop.com. The foams, our lipo foams, are meant to prevent and dissolve fibrosis. I have the video for our lipofoams. I have tons of videos on the lipofoams and fibrosis if you want to learn more about that and how it can help, but you are going to need foams to cover your entire Renuvion area. Those are also in our post-op shop. It's more important that you are making sure you're not doing any more damage before you start trying to do your MLD and everything else. Because if you start trying to do your manual lymphatic drainage massages, right, and you try putting in the foams, but you're in a garment that's squeezing the living daylights out of you, trapping that fluid in there and congealing it, you're just contributing to the problem. If you're eating out constantly and constantly having salt, like high levels of sodium in your diet, you are contributing to the problem. Renuvion and salt is a big thing. Because again, it's that coagulation, and salt thickens water. And it's already a coagulating process. We don't want to do that. So we want to keep the water moving. We don't want it like a thick, dried up swamp. We want to keep it moving like a river, and that's what manual lymphatic drainage does. It keeps that fluid moving and filtering out like a river back into your body. So manual lymphatic drainage to fix Renuvion, the foams to fix Renuvion, water, less sodium, and it's dependent for each person and each thing. I mean, I've helped people with Renuvion a year out that had skin irregularities, like dimpling and creasing and fibrotic everything, and we've gotten rid of all of it, and their skin heals. Is there some little contour irregularities? Yes, but it doesn't look like a crazy crater situation going on. It doesn't look like any of that, because the problem is the skin is not just congealing, the fibrosis underneath is thickening the skin. And that's why the skin doesn't move. And it feels very like tight. And it feels like there are little plastic bands like yanking your skin down. A lot of that is the fibrosis. The Renuvion should not be tightening your skin to the point where your skin doesn't move on your body and you have hyperpigmentation when you do this because you're losing circulation. That's fibrosis. That is not the Renuvion. That is a fibrotic process happening because you had swelling that is starting to congeal and thicken. That's all that is. But Renuvion is not bad. Renuvion works wonderfully. I love Renuvion. I think it's great. I think it's even better, and we see like lightning fast, amazing results, like so good when you are working with me, whether virtually or in person. Because you never even get that fibrosis. You never even get that hardening, that thickening, those bands. You never get any of that because we make sure that swelling stays moving and gets out of you and nothing winds up getting trapped under the skin. Because if you're leaving that stuff to get trapped, that stagnant fluid to get trapped under the skin and the skin shrink wrapping around it, you're going to see it and it's going to look crazy. So that's my little rant on that. Let's see if I have any more notes about this. Oh, Renuvion Burns. That's the other thing. Again, all the Renuvion Burns that I've seen have come from unlicensed medical practitioners that should not be touching these devices. Yes, because it is that heat. If the device can be calibrated to conservative settings or higher settings, depending on what area of the body we're working on, right? We need a different strength. We need a different amount of energy, all these different things. Having it on conservative settings will help, right? That's not going to guarantee, and this is, again, it's up to the surgeon and the technique and the way they're doing it. Just because it's on conservative settings doesn't mean you're not going to get burns or complications from it. This is where picking a surgeon is super, super important, and not going to a lunchtime lipo med spa to do Renuvion or body tight or jplasma. Don't do that. go find an actual surgeon, because this is something that needs to be very, 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 very specifically done by a trained person. It's like high definition lipo. It needs to be done by a specific surgeon and a specific person with a specific skill set that knows what they're doing. Now, just because you find that surgeon doesn't mean they know anything about aftercare. If you are watching this video, you need manual lymphatic drainage. You need to pick a surgeon that knows how to use the device and what they're doing. You need to make sure that you have the proper aftercare, because the surgeons don't think about aftercare. That's not their job. That's mine. That's yours. Your recovery is your responsibility. I say it all the time, and you guys get mad at me because the surgeons should tell you, but guess what? They don't know. They are not swelling specialists. They don't know how this works. They don't have experience with fixing these things, these complications. I do. So your aftercare is the most pivotal point of getting your results with Renuvion. This is not something where you can just be like, oh, I got a little bit of Renuvion done. I don't need to do massages. I don't need to wear my garment. I'm fine. I didn't even get lipo. I just got Renuvion. Yes, but as I say all the time, wherever there is swelling, there is a potential for fibrosis. And what people call irregularities under the skin is fibrosis. It's swelling that's getting trapped and thickening and congealing because it's trying to heal, but it's being shrunk and shrink wrapped around and stuck and stagnant. So that's what's going on with that. That's what I see a lot. Like I said, the burns that I've seen, and it's not just from Renuvion, I've seen it from any energy-based frequency device like Vase or Lipo. It's the surgeon and what they're doing that will cause the burns, right? It's not the device itself that it's bad. It's who's using it, right? The gas getting trapped, that whole thing, I haven't really... When people tell me that, and I've seen them, it's swelling. And we get rid of it. That's not something that I can confirm or deny as if it's like a real thing. I haven't done enough studies on that. I haven't seen enough case studies on it yet. So I'm not going to speak about that, but I can tell you the one time that I did have someone come in saying they had gas stuck in them, it was not. It was swelling, and it went away by the end of the session. And that was the end of it. And I could feel that it was congealed swelling. It wasn't an air bubble or a gas pocket. It was congealed thick swelling, but I'm sure there are medical reports on that complication of Renuvion that I could find and explain it to you guys better. But until I do, that's what I will say from my experience. That's what it was. The surgeons don't know. The surgeons know how to do the surgery. They don't know really much about the healing. They know what it's supposed to heal like. They know that these things happen and it's common, and that's as far as it goes. That doesn't mean it needs to happen. Doesn't mean it's required to happen. Doesn't mean it should happen. But they kind of just see it as it is. But I'm going to show you guys real quick what this little device looks like. So this is what it looks like. This is your collagen fibers, these white things, and this little this little plasma energy beam shoots back and forth. It seeks out these fibers and it zaps them, and then the plasma gas that's in there helps to start shrinking down the skin. That's how it works. It shortens and shrinks and zaps the fibers. So that's what it looks like. Like I said, guys, I am going to share, I'll share a post with a couple different videos. It'll be a post. It'll have a couple different videos. One of that chicken thigh skin that's shrinking. One of the actual device where you can see the lightning under the skin moving from side to side and see the precision of it and what it actually is and what it's actually doing under the skin. Because it's important for you guys to know that stuff. But when it comes to making sure you don't have complications from Renuvion or fixing complications from Renuvion, it's all about the swelling. It's about manual lymphatic drainage. It's about how fibrosis is made and how to get rid of it. It's about the foams. It's about the compression. It's literally all about the aftercare, because I've seen Renuvion go splendid, beyond beautiful, so perfect you would never think this woman ever had kids or ever had anything wrong with her stomach at all or her body, beyond perfect. And then I've seen it where it's 9 weeks out, 10 weeks out, 3 months out, 4 months out, and it looks crazy. It looks crazy because we got massages that were aggressive and caused more compaction and more swelling to get trapped under the skin, causing more little pockets of swelling that then turned to congealed thick lumps of fibrosis. We've been in garments that weren't giving us any actual support. So we were swelling up. We were eating out every single day. Like, I've seen the worst of the worst and the best of the best with Renuvion. And I'm telling you, you don't have to go through that. If you are having Renuvion complications, call the office, 732-841-0142. I do virtuals to help with the Renuvion complications. Even before all of that, if you are getting any kind of skin tightening, energy-based frequency device like Renuvion or Body Tight, please, please, for the love of all that is holy, have a certified manual lymphatic drainage therapist doing your massages. Do not go to someone who offers lymph massage and is going to rub you with oil or use cups and tools and more energy devices that's going to make what you're going through worse. No machines, please, after Renuvion. Absolutely not. That is a huge no. No machines ever after plastic surgery. No radio frequency, no cavitation, none of that. I have a whole video on that. But the best thing that you could do for yourself, because I could tell you this till the cows come home and you'll be like, well, I still don't understand what manual lymphatic drainage is. I still don't understand how this works. I don't know what to look for in a therapist. Because that's the thing, guys. You can't just look for a therapist. You have to actually pick. The same way you pick a surgeon, you have to pick a therapist to do your aftercare. It's not just like, anybody who knows this is a great example. You can just walk into a nail salon and get your nails done, right? Or you can find someone that does exactly what you want with your nails, exactly the way you want it, like cuts your cuticles perfectly, does your nail polish perfectly, like knows exactly what to do because they know what they're doing. Because you got them as a referral or because you found them, and you know they know what they're doing. If you don't know if your therapist knows what they're doing, how are you going to know if you're getting the right kind of massage that's not going to cause you complications? You don't know what your therapist is supposed to be doing. That's why you need the course. Because once you know what your therapist is supposed to be doing, you will call them and be like, hey, these are the major lymph nodes. Do you address these first? Hey, do you have these letters after your name? Hey, are you this certified? You'll be able to ask them competent questions with the understanding of what they're supposed to know, to be able to know that they're going to do the right thing, especially with Renuvion, guys. This stuff works great if you have someone helping you with it. If you don't, call the office, 732-841-0142. Set up a virtual with me, or I'm in New Jersey, Highland Park and Elizabeth. You can come in. First thing I would absolutely do before that is go to our post-op shop, buy a pack or two, depending on what area you've had done, of the lipo foams and place them in your garment, whatever garment you have, place them in, because the foams create lymphatic stimulation on your skin immediately and will help stop the fibrotic process that's happening under your skin, that tethering down. It will help stop that, soften it, reverse it, turn it back to fluid, and then you will pee that fluid out during your MLD sessions. But that's the very first thing you should be doing is scheduling a virtual with me and ordering your foams immediately, especially if you're having that, because this happens quick. With Renuvion, it happens very, very, very quick. It can happen within the first 48 hours. It can happen within the first day, and then it can continue happening up to 9 weeks, 10 weeks, 4 months, continuing to get worse, because this process, like we read before, lasts for 6 to 9 months. So, to wrap it up in a pretty little bow, Renuvion is an energy-based device. It uses plasma energy, which is pro-helium gas and radio frequency. It is a dual thermal device, which means that it heats and cools to help shrink wrap the skin. Complications with Renuvion that are most commonly seen are the burns, the lumps, the bumps, the skin irregularities. Those lumps, bumps, and skin irregularities can be taken care of and gotten rid of with the foams and with your massages and with cutting back on the sodium and with drinking enough water. But more so than anything, the foams and the massages. Those complications are not necessary. They do not need to happen. Do they happen? Yes. Do we need them there? No. Can we get rid of them? Yes. The Renuvion will continue working to tighten your skin for 6 to 9 months, up to that mark. So anywhere in between there, we can still get rid of that tethering, that leathery skin, that tightness, that thickness, that binding, those lumps, those bumps, those irregularities. We can get rid of that with the foams and manual lymphatic drainage. You need to find a properly certified manual lymphatic drainage therapist. Go get the course in our post-op shop. Go get the foams in our post-op shop. Call my office. Set up a virtual with me. But Renuvion works beautifully if you are on it with your aftercare. If you are not, your body will start to congeal and try to make that into fibrous tissue. If your garment is too tight, if your garment is too loose, if you're not like fully understanding your aftercare, fully understanding what your body's going to be going through as far as the phases of wound healing, if you're not really understanding it, it can get real bad real quick. If you're confused about your aftercare and there are like still areas that are like gray areas in your head where you're like, I don't really know, you need to iron that out before you get Renuvion, or even after when you're having complications. That's the thing that's missing. So your aftercare is like the number one thing if you're getting Renuvion tightening. It works, guys. It works wonders, but you have to be so hyper on it with your massages and your aftercare. But man, does it work. And I think that's pretty much it. A lot of the complications that I've seen are from people that are not supposed to be using this device because they are not medically certified to be using it and wind up doing it anyway. You can get burns from Renuvion because it is that heat energy under the skin. That fibrosis is the most common thing. The lumps, the bumps, the hardness, the discoloration of the skin due to lack of circulation from the fibrosis under the skin because it's a second layer of damage. But we can fix all of that. We can. Up to 9 months. We can fix all of that. It's better to do it obviously before then. It's a lot more challenging and takes a lot longer at 9 months. And then we may have some permanent irregularities that we need to then fix with a little bit of liposuction or something else. But yeah, the sooner you realize that your Renuvion is starting to thicken and tighten, and the sooner you find this video and the sooner you call me and set up that virtual, is the quicker we're going to get away from having to do any kind of revision at all. Even like I said, 9 weeks out, 10 weeks out, we can still clean it up and see what's actually like, well, if we even need to do a revision at that point, but we can still clean it up real nice. If not, get rid of all of it, because I have gotten rid of all of it where we don't even need a revision. So guys, that is my rant on Renuvion. It is not bad. It is a great device. I think it works beautifully. I will put up a couple posts so that you guys can actually see what it's doing under there and what's going on. And this video will go up today, Friday, on our YouTube. But guys, that's it. Ashley with Amare. Little bit about Renuvion. You know where to find me if you need me. And I will see you guys soon. I hope this was helpful. And if you did get Renuvion and you have problems and you need me, call the office, set up a virtual, or come in, because there's no reason you should have to live with that. Just saying. Okay, Ashley with Amare. Bye.